Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mrs. Wright. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Afternoon, Mrs. Wright. I'm Dr. Kildare. Now, unfortunately, your usual GP is away today, so I'm going to help you if that's okay.
That's fine, thank you for seeing me.
Okay, so I've got some notes, but it'd be helpful if you could tell me, in your own words, about the problems you've been having.
Well, Dr. Grimmett asked me to come back and check in about my foot. I've had gout, you see.
Okay, so just remind me, what happened with your gout?
Well, the first time was late last year, about 2 or 3 months ago. Dr. Grimmett had to treat me at home. It was pretty bad. I could hardly walk.
Oh.
We used steroids in the end to get a hold of it. I had the prednisone tablets, 30 milligrams for 5 days.
Right.
All the blood tests showed that I had the tendency to gout from crystals, so Dr. Grimmett gave me the allopurinol, trying to calm that down longer term. The doctor said to contact the clinic if it got worse, or come back around now just to check in.
Right. So we haven't seen you. Is that a good sign?
Well, I had, it was a good job I had the repeat prescription for steroids, because just after Christmas I had a bit of a flare-up again. I suppose I was eating a bit too much rich food and probably had more to drink than normal, but I have been watching it a bit. The doctor recommended I drink more water. He said 8 glasses, a couple of litres, and I've been trying, but it's a lot, you know, and I'm busy, so I don't think I drink more than 6 glasses through the day, but it's definitely more than before.
Right, well, that's really good to hear. Water can definitely help, so it's great that you're keeping that up. Sorry, do you mind just describing where the swelling was when you had it?
Yes, sure. Well, both times it started down the side, kind of at the base of the second toe on my left foot, there. And then the whole foot swelled up across my smaller toes to the outside of my foot.
Ah, I see.
And both times I started getting a lot of pain, and it was all kind of spreading down from that area, and it went across the toes and started swelling up quite badly, really hot and inflamed. But it never goes to the big toe. So the second time, it never swelled up quite as bad as it did before, but I think I caught it in time when I went and got the steroid tablets from the chemist.
Ah, good. So how long did it take to settle down once you started the tablets?
It was a lot better than last time. I went straight back down within a week, so it was a lot better.
Right, and when it settled down completely, is it back to normal?
No, it's never been back to normal. I still have pain on that second toe where it always was right from the start, and I've still got it now.
Right, and how are you getting on with the allopurinol?
Yes, it seems to be better. I don't have any problems with it. I'm taking them okay, but like I say, that second toe is still giving me a little bit of a problem.
I see.
At the time, the doctor actually wondered if it might be a stress fracture, but I had a foot x-ray and that was clear. But I just think it's a bit unusual that it's still sore, and at the same time, everything points to gout, and the blood test confirmed that was the most likely thing. But that toe, it isn't the usual joint, as you know, for gout. It's usually the big joint, isn't it?
Yes, that's right. The big toe is typical.
But when I had the flare-up, the steroids really helped quite quickly. I stopped taking painkillers after 2 days at most. I feel like it's less severe and we've got a hold of it better, so I guess that means the allopurinol is helping, right?
Yes, I think so. So I'm still quite keen to carry on with that tack.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Noah Baxter. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning. Good morning. What's your problem? Well, doctor, I have intolerance to allergies, inhalant and environmental allergies. Okay, do you get any kind of reactions like an itchy rash, throat or tongue swelling, shortness of breath, vomiting, lightheadedness, and low blood pressure? Clinically, these symptoms show the presence of anaphylaxis. No, doctor. Or else, do you get itchy red welts called angioedema that develop on your skin? No, doctor. Are you taking any medication for allergies? No, doctor. May I know your past medical history? 6 months back, when I was under dialysis due to renal failure, I had an acute event of perioral swelling, etiology uncertain. The diagnosis results showed that the allergic reaction was due to Ceflax that was used to treat a cellulitis dialysis shunt infection. What medications are you taking now? I am taking atenolol for controlling my blood pressure, sodium bicarbonate, Lovatsa, and Dialovite. I didn't have any other issues upon my treatment and discharge. That included corticosteroid therapy and antihistamine therapy and monitoring. What were the surgeries performed? Perm cath insertion 3 times and peritoneal dialysis. Are you allergic to any medications? Yes, heparin causes thrombocytopenia. Do you drink or smoke? No, doctor. May I know your family history of diseases? My family members have severe heart disease, carcinoma, and food allergies. Well, your test report shows your blood pressure is 128/78, pulse 70, temperature is 97.8, weight is 207 pounds, and height is 5 feet 7 inches. I suspect you have developed acute anaphylaxis. I would suggest you to go for a radioallergosorbent test, a blood test using radioimmunoassay test to investigate specific IgE antibodies to determine the substances the subject is allergic to. I shall recommend further treatment and medications upon the test results. If the test report shows any specific food or inhalant allergen that is found to be quite high on the sensitivity scale, I would likely recommend that you avoid the offending agent. Right now, I would recommend you to stop further usage of cephalosporin antibiotics, which may be the cause of your allergic reaction, and I would consider your case as an allergy. Being on atenolol, it would be very difficult to treat acute anaphylaxis. I am prescribing an EpiPen in the event of acute angioedema or allergic reaction or sensation of impeding allergic reaction, and you have to proceed directly to the emergency room for further evaluation and treatment recommendations after the administration of an EpiPen.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a physician explaining about the treatments for major depressive disorder. Now read the question.
A major depressive disorder is one of the most severe, troublesome, and costly psychiatric diseases. Although there are pharmacological and non-pharmacological treatments, often antidepressants are used more frequently than psychological interventions due to inadequate resources. Our efforts are to promote the evidence-based prescription of these antidepressants in the future. Therefore, we are now focused to update and expand our previous efforts to compare and categorize antidepressants for treating a major depressive disorder. All antidepressants were more efficacious compared with placebos while treating the adults with a major depressive disorder. While the effect was lesser in the placebo-controlled patients, the variation in efficacy and acceptability was more in the patients treated with antidepressants. Therefore, these findings should promote the evidence-based prescription of antidepressants and apprise the physicians, patients, and policymakers on the merits of various antidepressants. One of the most crucial challenges worldwide is the routine prescription of antidepressants for the treatment of a major depressive disorder. Nevertheless, in the scientific literature, there are considerable ongoing debates about the effectiveness of antidepressants as well as the potential differences in tolerance and effectiveness due to individual drugs. With the introduction of new antidepressants into the market and the increasing numbers of trials published every year, we have realized the significance of systematic review and meta-analysis to synthesize the evidence in this crucial clinical issue.
Question 26. You hear a nurse briefing a colleague at the end of her shift. Now read the question.
Okay, so the next thing is about Susie Williams in bed 3.
Right.
She's been admitted for chest pain to rule out MI. So far she had an EKG, which was okay, and the first set of cardiac enzymes and troponins are negative. When she came in, her blood pressure was elevated a little, like 182/95, but she was given losartan, and at 6 o'clock it was 142/82. She was also dehydrated, so we started her on IV fluids. D5, half normal saline, running at 125 millilitres. That can go until midnight, and then it can be disconnected. She's scheduled for a stress test tomorrow, and some more enzyme tests. Okay?
Okay.
Question 27. You hear a dietitian talking to a patient. Now read the question.
So what seems to be the problem?
I feel such a failure. I'm sure people think that if I just tried harder, I could lose weight. Maybe I need more willpower.
Well, firstly, well done for seeking medical help. Actually, being overweight or obese is a medical problem, because being overweight changes how your body works.
Oh, thanks, but I do feel that it's my fault for being this way.
Well, I hear what you say, but please understand that these days we consider that obesity is a disease, like high blood pressure or asthma. You see, the body's signals to the brain stop working correctly when you're overweight, and with time you feel less full, even if you eat the same amount. And when you cut calories, your body tries to use less energy to keep your weight the same.
Question 28. You hear a monologue by a physician explaining about lupus disease. Now read the question.
Lupus is a chronic autoimmune disease in which the immune system becomes hyperactive and attacks healthy tissue, resulting in such as inflammation, swelling, and damage to skin, joints, blood, kidneys, the heart, and lungs. Normally, our immune system makes proteins called antibodies to protect and fight against antigens such as bacteria and viruses. However, lupus makes the immune system unable to differentiate between the healthy tissue and antigens, which leads the immune system to direct antibodies against the healthy tissue instead of antigen.
Question 29. You hear a consultant talking to a trainee about a patient's eye condition. Now read the question.
Have we got Mrs. Kent's notes?
Yes, they're here. She's coming in today for possible laser surgery for her retinopathy, isn't she?
Well, depending on results. And from the look of these pictures we took last time, there's been a slow improvement. So we'll talk to her, and perhaps hold off for the time being. Unless her condition's worsened, because it can in some cases.
So what's the cause?
Well, we know a leak of fluid behind the retina causes the distorted vision which sufferers get, but not why that occurs. There may be a link with stress, and also steroid use, but the jury's still out, I'm afraid.
Question 30. You hear part of a hospital management meeting where a concern is being discussed. Now read the question.
Now I'll hand over to Jenny, who has a few words to say about staffing. Jenny?
Thanks. Now, if we compare ourselves to other hospitals of the same size in other regions, we're actually recording lower rates of staff turnover. That's just as well, given the challenges filling vacant positions across the sector. Where we do compare unfavorably is in the number of days lost to sick leave. That's making it hard to maintain full cover on the wards, and we all know the costs of that. As a matter of urgency, then, HR are looking into the worst affected areas to understand the reasons behind it and to see if there's anything we can do to help and support the staff involved.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear a healthcare practitioner talking about aspects of their work. For questions 31 to 42, choose answer A, B or C, which you think best fits according to the text. Extract 1, question 31 to 36. You hear a doctor, Courtney Stanton, delivering a presentation on arthrosclerosis. You now have 90 seconds to read questions 31 to 36.
Hello everyone, my name is Dr. Courtney Stanton, and today we're going to discuss atherosclerosis. This is a disease in which plaque builds up inside your arteries, the blood vessels that carry oxygen-rich blood to your heart and other parts of your body. Plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. Over time, plaque hardens and narrows your arteries. This limits the flow of oxygen-rich blood to your organs and other parts of your body. Atherosclerosis can lead to serious problems including heart attack, stroke, or even death. The exact cause of the condition isn't known, however studies show that it is a slow, complex disease that may start in childhood. It develops faster as you age. Atherosclerosis may start when certain lifestyle factors damage the inner layers of the arteries. These factors include smoking, high amounts of certain fats and cholesterol in the blood, high blood pressure, high amounts of sugar in the blood due to insulin resistance or diabetes. Plaque may begin to build up where the arteries are damaged. Over time, plaque hardens and narrows the arteries. Eventually, an area of plaque can rupture or break open. When this happens, blood cell fragments, called platelets, stick to the sites of the injury. They may clump together to form blood clots. Clots narrow the arteries even more, limiting the flow of oxygen-rich blood to your body. Depending on which arteries are affected, blood clots can worsen angina, chest pain, or worse, cause a heart attack or stroke. Researchers continue to look for the causes of atherosclerosis, and they hope to find the answers to such questions as why and how the arteries become damaged, how plaque develops and changes over time, why plaque ruptures and leads to blood clots. They are particularly aware that there are certain risk factors. In fact, many factors place you at risk of atherosclerosis. Some of these risks can be prevented, whilst others cannot. The first risk factor is family history. If atherosclerosis runs in a person's family, then they may be at risk of hardening of the arteries. This condition, as well as other heart-related problems, may be inherited. Lack of exercise. Regular exercise is good for the heart. It keeps the muscles strong and encourages oxygen and blood flow throughout the body. Living a sedentary lifestyle increases your risk of a host of medical conditions, including heart disease. A third risk factor is high blood pressure, which can damage blood vessels by making them weak in some areas. Cholesterol and other substances in the blood may reduce the flexibility of arteries over time. A fourth risk factor is smoking. Smoking tobacco products can damage blood vessels and other areas of the heart. The final risk factor that I'll highlight today is diabetes. People with diabetes tend to have a much higher incidence of coronary artery disease. Most symptoms of atherosclerosis aren't noticeable until a blockage occurs. Common symptoms include chest pain or angina, pain in the leg, arm, and anywhere else that has a blocked artery, shortness of breath, fatigue, confusion, which occurs if the blockage affects the circulation to the brain, and muscle weakness in the legs from lack of circulation. Once a blockage occurs, it's generally there to stay. With medication and lifestyle changes, though, plaque may slow or stop growing. They may even shrink slightly with aggressive treatment. Treatment options include lifestyle changes. Reducing risk factors that lead to atherosclerosis will stop or slow the process. That means a healthy diet, exercise, and no smoking. These changes won't remove blockages, but they are proven to lower the risk of heart attacks and stroke. Medication. Taking drugs for high cholesterol and high blood pressure will slow and may even halt atherosclerosis. They could also lower the risk of heart attack and stroke. Doctors can use invasive techniques to open up blockages from atherosclerosis or go around them. Stenting. Using a thin tube inserted into an artery in the arm or the leg, doctors can get to diseased arteries. Blockages are visible on a live X-ray screen. Angioplasty and stenting can often open up a blocked artery. Stenting helps to reduce the symptoms, although it does not prevent future heart attacks. Bypass surgery. Surgeons harvest a healthy blood vessel, often from the leg or the chest. They use the healthy vessel to go around the blocked segment. These procedures can have complications. They're usually safe for people with significant symptoms or limitations caused by atherosclerosis.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Dr. Catherine Frenette. Some of the numbers we're reading are really kind of shocking. I was reading that the number of unresectable liver cancers has actually grown by 115% in the past decade. Why are we seeing some of these numbers rise when it comes to liver cancer?
So liver cancer, or cancer that starts in the liver, is really caused, most patients who have liver cancer have underlying liver disease or cirrhosis of the liver, scar tissue in the liver. And we're seeing more patients with fatty liver causing cirrhosis and an increase in liver cancer because of that. And then also still seeing a lot of patients with hepatitis C developing liver cancer, even though we've got great treatments for that virus as well.
So a lot of times people connect liver disease with people who drink excessive amounts of alcohol. But as you're saying, hepatitis is a factor here, and we're seeing it in more people that maybe aren't abusive of alcohol.
Absolutely. Alcohol isn't even the most common cause for cirrhosis. The most common reasons really is fatty liver, which is associated with diabetes, high cholesterol, obesity, and the metabolic problems that we're seeing on the rise as well. And then viral hepatitis is the second most common.
Wow. So when we're talking about treatments of liver disease, liver cancer, there's really not too many options out there. What are we looking at as far as new treatments and treatments that have been shown to be somewhat successful?
Yeah, so when we're thinking about liver cancer, as I said, most people have underlying liver disease. So liver cancer is a little different than other cancers because we have to think about the underlying liver problems in addition to thinking cancer itself, which is why a lot of liver cancers are treated by liver doctors and not necessarily cancer doctors. So most of the time, the best treatments are surgical, either cutting it out or doing a liver transplant. But unfortunately, most patients, about 80% of patients, aren't diagnosed in time to get that surgical treatment. And that's when we really are talking about the unresectable or inoperable liver cancers, where we're now thinking about the new treatments that we have available.
And I would imagine, as we see with other cancers, the reason it's being diagnosed so late is because the symptoms are kind of all over the place. So let's talk about the symptoms and what those typically are for both liver disease and liver cancer.
Yeah, so liver disease really doesn't cause a lot of symptoms until it's advanced. And this is part of the problem with diagnosing liver disease and diagnosing liver cancer. As I say to my patients, the liver is a very forgiving organ. So it has to go through a lot of damage before it actually causes symptoms. And that might be things like tiredness, itching, yellow eyes, swelling in the legs, swelling or water buildup in the abdomen, and confusion and not thinking clearly. Those are some of the advanced symptoms that we see. But when it's early liver disease, we really don't see a lot of symptoms at all. Liver cancer is the same way. So if you think about the liver, it's about the size of a football. We want to find a cancer when it's the size of a golf ball, and you can hide a lot of golf balls inside of a football without having any symptoms at all. So when somebody has liver disease, it's important that we actually do screening for liver cancer, and we check them every 6 months with lab tests and imaging tests, an ultrasound or a CAT scan or an MRI, so that we can find these cancers when they're early.
Who's a good candidate for doing screening before there are any symptoms? Maybe you have a history of it in your family. Maybe you know that you haven't been exactly great about your alcohol use or smoking, other risk factors. Can you walk into your doctor and say, hey, for my liver function?
Absolutely. So liver function screening is really just a lab test. There's an easy lab panel that we can get, and primary care doctors often do it, but not always, as part of the yearly physical. But if you have risk factors for liver disease, it is important to know what your liver panel looks like and know whether you have liver problems or not.
Okay. And are there different ways to diagnose what the problem might be if the liver function test is off?
So if somebody has elevated liver function tests, then the next step is we do a whole panel of labs to try to diagnose why they have those liver function problems, because there's a lot of things that can affect the liver. We also see sometimes where people can just have one-time elevations of liver tests and it goes back to normal, and that doesn't mean anything if it's just one-time elevated, unless you also have risk factors.
Yeah, so again, that forgiving organ. Yes. And really, liver cancer, even though we've seen these numbers kind of skyrocket, it doesn't seem to get the attention that some of the other cancers do. Why do you think that is?
So I think that liver cancer right now is actually the 5th most common cause of cancer-related deaths, and it's actually one of the few cancer deaths that's actually increasing in incidence and frequency as compared to decreasing. Most cancer deaths are actually going down. Liver problems, as you said, oftentimes are associated with alcohol or drug use or things like that. So there's a lot of social stigma that happens when people who have liver disease, and I think that's part of it, where we're not really seeing that information come through because there is that stigma.
That is the end of Part C. You now have 2 minutes to check your answers.